participants open. So, welcome everyone. We are going to do another installment of Medicare. This one is Medicare Part D drug plans. Our presenter is Lisa Pino from she's shift coordinator for Norwescap, Inc. Just a couple Zoom etiquette. If you can remain on mute unless you have any questions. And at that point, you can either put them in the chat or you can wait till Lisa's done and ask her those questions after we're finished with the program. And we have someone else coming in. And Lisa, welcome. And please feel free to get started.
All right, thank you. Hello, everyone. My name is Lisa. I work for Norwescap Incorporated in Rockaway, New Jersey. We are a nonprofit organization that offers SHIP counseling, which is Medicare counseling, as well as many other programs for seniors. So if you have any questions, if you have any questions, not only about Medicare, but about any of the programs that we may offer and you want more information, please call our offices. I will give you my contact information at the end, as well as our main number. This is about Medicare Part D and how to choose the right plan for you. Part D, where does it come in? Well, you have original Medicare, where your Part A coverage comes in. You have your Part B, which is the doctor and outpatient coverage. You have your Medicare supplement that covers the 20% medical coverage that Medicare does not take care of for you, because Medicare is 80% their responsibility, 20% your responsibility. And then you have a separate Part D drug plan. So everything in the original Medicare is separate. And we're going to be talking about the drug plans today. Now, the other part of Medicare is known as Medicare Advantage, otherwise known as Part C. Now, this combines Part A, Part B, and a Medicare supplement to take care of the 20%. However, your drug plan will not be included in about 90% of the cases here. So you still have to choose a drug plan. You could choose a Medicare standalone drug plan to go with original Medicare. If you need to choose a standalone drug plan based on your current situation, you could choose one through Medicare, or you may use your employer or retirement drug plan if your company offers one. It must prove to be what's called credible coverage, and that means it has to be equal or better than Medicare coverage. And your employer or retirement plan should give you a letter every year stating that this is the case. And it usually comes around tax time, like right before tax time. The plans offered by Medicare, they are offered by insurance companies under contract with Medicare. They are a list of companies and plans that change every single year. Some plans are national plans that they can be taken anywhere in the US. And those are good for people who travel, such as, but snowbirds I'm talking about, that they like to spend 5 to 6 months out of the year in Florida, Arizona, in a warmer climate. There are other plans that you need to stay either in your county or in your state in order to get coverage. Plan restrictions. Usually there are quantity limits that limits the number of pills that you can get at a given time. Prior authorization is something that may require you to get approval from the plan before you can actually get the drug. And step therapy. Sometimes they're going to require you to try a preferred brand before you obtain the name brand drug. Medicare drug plan costs. There is a premium, and that is what you pay every month in order to have the plan. There's a deductible, which is what you are required to pay before the plan actually kicks in and starts to cover your drugs. The initial coverage period, which is that you pay a copay for that drug until you reach $4,430 in total drug costs. That's not just what you're paying, that's also what the plan is paying. So combined together, you will reach that goal. The coverage gap, also known as the donut hole, that is where you're going to pay 25% of costs until you reach your out of pocket for the year, which is $7,050. Okay, and again, that's combined. That's not just on your shoulders. That's even what the plan is putting in, total costs. Then you reach your catastrophic benefit. This is when you may pay a small copay, $3.95 to $9.95, or 5% of the drug for the rest of the year. Now, here's an example of how it works. Mrs. Smith pays her premium every month for her drug plan. She pays a copayment for her drugs, and her plan pays its share for each covered drug until their combined amount, plus the deductible, this also includes your deductible now, reaches $4,430. Once she reaches that goal for the covered drugs, she's now in the coverage gap, which is the donut hole. She has a 70% discount from the drug manufacturer when you're in the donut hole. And that's on the total cost of brand name drugs purchased while in the donut hole. She gets an additional 5% discount from her plan for covered name brand drugs and will receive a 75% discount from her plan on generic drugs. Those discounts plus what she spends out of pocket is all going to be counted towards the $4,430 limit in that donut hole area. Once that happens and she's reached that limit, she's now in the catastrophic coverage and only pays a small copayment for each covered drug to the end of the year. What you need to consider when purchasing a plan or looking at several plans. Are my drugs covered by the plan? Are there any restrictions that you need to be aware of? Look at the costs, every cost, the premium, the copays, the deductibles, and how soon you will reach the coverage gap. Now, this can be shown to you on a computer that we have in our offices or our laptops. We are mobile. We have 20 counselors that work throughout Morris County, and we could show you plan by plan comparisons that'll tell you all of this. It breaks it down between the premium, the copays, the deductibles. It shows you how much you're going to spend the entire year with everything included. And that's what you want to look at, that overall, what am I spending for the entire year? Don't just look at the premium. Don't just look at whether or not you have deductible. You want to see what you're paying completely, everything included for the entire year. And that's how you're going to get the best drug plan for your money. And your pharmacy, very important, is it in the plan network? Do they offer mail order? Sometimes it's cheaper, but not always. I have to tell you, I've the two people that I just counseled recently, mail order was the same price. It is no longer necessarily the least expensive way to go. So just be aware of that. You don't have to use it, but they will show you the comparison between mail order and a local pharmacy. The availability is important. Is it available across the United States? Or do you need to remain in their coverage area to get coverage? In other words, do you need to go to a pharmacy that's in your county or simply in your state? If you spend 6 months out of the year in a warmer climate, you're not going to be able to take a plan like that with you and go to CVS out in Arizona or in Florida and still get the same coverage, or you probably won't get any coverage. So just be aware of that. Employer plans. This is one thing we cannot help you with that much. What we can tell you, and this is what we always tell everyone, when you are joining Medicare, and if there is a plan that your employer or that your retirement plan want, and you want to keep that, that's fine. But you need to just make sure, go to your human resources representative and find out how that is going to work together. Normally, Medicare is the first payer. And then your employer plan usually pays second. But just confirm how that's going to work and how the coverage is going to work together as far as what your drugs are actually going to be costing you. How do I switch drug plans if I don't like the drug plan that I'm in? Or if I simply want a new one at the end of the year because I've been told that my plan is no longer being offered, which does happen. Now, you can't do this in the middle of the year, okay? I have to let you know that. Usually when you join during open enrollment, you have until the next open enrollment time to change plans. However, if you're new to Medicare, you do have, I believe it's a 1 month, 2 months to try out your drug plan and see if you like it. You would simply contact the plan that you want to join and enroll with them. Normally, you do not need to cancel your old drug plan. However, I always tell everyone, please check when let's say that your new drug plan starts January 1st. January 2nd or 3rd, call your old drug plan and make sure it was canceled. Unfortunately, some people have still gotten a bill. Mistakes happen. So I always ask people to please confirm with their old drug plan. Never take that for granted that they're supposed to cancel it for you, even though they should. What about the late enrollment penalty? This is very important. If you do not take a Part D plan when you are eligible for Medicare. Now, this is assuming you're not working and you're not taking your employer plan, don't have a retirement plan that you're using. You've eliminated all of that and you are just going on Medicare alone. If you do not take Part D, because I have people say, oh, I'm not taking any medications, I'm not going to waste my money right now and take a drug plan. You are going to be subject to a late enrollment penalty because you didn't take Medicare Part D when you should have. And that is for life. That doesn't go away. It's not a temporary fee that you pay once and get rid of. That's for the rest of the time that you are on Medicare. So Medicare, not the actual Part D plan, calculates the late enrollment penalty. The cost is typically 1% of what's called the national based beneficiary premium for each month that you do not have Medicare Part D. That monthly penalty is rounded to the nearest 10 cents and added to the Part D premium that you pay every month. And like I said, that's permanent. Now, right now, for 2022, the base beneficiary premium is $33.37. And an example of this, I have to minimize my screen here to see this, is Mr. Ray was eligible in December of 2019 to join Part D. He chose not to do this. He decided to join Part D in the 2021 open enrollment period. This means that his coverage will not start till January 1st of 2022. There's going to be a full 24-month period that he would not have coverage. Now that's 1% for each uncovered month equals 24%. 24% times 33.37 is 801. 801 rounded to the nearest 10 cents is $8. So $8 per month will be added to Mr. A's Part D premium cost every month. He's a little lucky, being that it's only $8. Still, it's $8 he could have saved, but I've had people that didn't take it for years and then finally decided they needed it. And you times that times 5-6 years, you're in trouble. That can be quite costly. So please be aware of that. I always tell people, take the cheapest plan, the very cheapest plan, just to avoid the late enrollment penalty if you don't take any drugs at all. We have plans that maybe cost only $13 a month. At least it prevents you from getting that late enrollment penalty. And finally, if you need help, any questions that you have, if you need to make an appointment with us, we're not only available during open enrollment. Now, you could call us any time of the year and talk to us and ask us questions about any part of Medicare. If you're having trouble, if you think you're being billed for something that your insurance normally used to cover and you're not sure why, please call us. We can help you figure that out. We can help you enroll in Medicare, not enroll in Medicare through Social Security, but we can help you enroll in a Medicare Advantage plan. We can help you compare plans, supplemental plans, and Part D plans as well, so that you're well informed and you know exactly what plan you want to take. We have virtual, in-person, and phone assistance available. Sometimes questions could just be answered over the phone, but by all means, we are open to in-person appointments. And we have over 20 counselors throughout Morris County, so there is always somebody available to you. And we try to set you up with someone who's relatively close to your location so you don't travel too far. This is our address, Pine Street, Suite 101 in Rockaway, and our main number in order to connect with a SHIP counselor is 973-784-4900. And as I said, the SHIP counselor that's closest to you with available appointments will call you back. Okay. And one more thing, if anybody, yourself, a loved one, a friend that you know of is in need of help paying their Medicare bills, prescription drug bills, it could be getting that Part B reimbursement that is available to certain qualified individuals, please call us. We could screen you or them over the phone to find out if you qualify for this assistance. Some of the incomes are on the low side for qualifying, some are not. Some are actually quite high, especially the Part D drug coverage savings programs. You actually can save quite a lot, and the incomes are not that low. Don't think that you have to be Medicaid qualified in order to qualify for these programs. It is quite different. Some of the programs do not take assets, which is a huge help. So please reach out if you have any questions. Please let me know. I can answer them now. I can answer them in an email, or you can give us a call if you think of something later. No worries.
So Aida or Dawn, if you would like to unmute yourselves, if you have any questions, or if you would prefer to just take a picture of this phone number and call because maybe your questions are more personal, that's fine too. I know that Lisa has answered a lot of questions for me, and it was very helpful. So I'm just going to ask you both to unmute, and then if you'd like to unmute, please feel free and go ahead if you have any questions, or if you feel more comfortable, you can go over to the chat box and you can, put your question right there under Lisa, and you could just, it's just like a little pull down, and then you put the question right there if you would prefer to do that also. Oh, hi, Don.
Hi, folks. Hi, Lisa. Thanks.
Hi.
Thanks for the information. I'm sorry that I missed. I signed up for the one that you had a couple of weeks ago or last week, and I wanted to sit in this one because I'm taking over my mother's financials and medical information, and it's a little overwhelming. I mean,
Yes, it is. Absolutely.
Yeah. So, I came across her medical card, and I think she pays $199 a month, and she's kind of like physically healthy as a horse. She doesn't take even aspirin if she doesn't have to. So it just seemed egregious, and I don't know what Plan B, the
The supplement that she
yeah.
has.
Yeah, I don't know what the supplement is compared to the regular B, and I'm just trying to get my head around all these components and make sure that I didn't miss one. She had just moved her from Florida. I want to make sure I'm not missing a bill, and then God forbid it lapses. Like what
I highly recommend you and your mom, or even if just you, if that's better, since you're taking over her financial and medical situation. Definitely sit down with a SHIP counselor, but she'll tell you everything that you need to bring. You're probably going to need her current Medicare cards, her current supplement cards, so we know what she currently has, including her drug card and all of her medications. This way, if she's paying, about $200 a month for a drug plan and she doesn't even take medicine, that is a little too costly at this particular time. I always recommend someone takes a drug plan, but I agree that's a bit high for someone who doesn't even take any medication. We could find something else, I'm sure.
Okay, well, thanks. Yeah, you know what? I'll definitely give the number a call and see if I can set something up for her and myself, and we can come down and
okay.
That's a good idea. That's a very good idea.
Yes, and just make sure that you give the individual an email address is preferable, only because we used to mail out a checklist to bring to our counseling sessions, but with the mail situation, we are highly recommending everyone use email. We could just email you that information. It's a lot faster and more efficient.
Oh, for sure. Right. Thanks again.
Right.
Okay.
And then you can just print it and it's right there and you'll know what's going on. And Aida said, thanks. She doesn't have any questions right now.
Okay. I can even email the slides to Jean Marie. So yeah.
You did that last time. That was a huge help, and I did email that to everyone, so that would be a big help to me. Thank you, Aida and Don. I will actually send it to everyone that was on the sign up, and I just got a message that for some reason somebody didn't see the link in the but we'll email that stuff to her anyway, so that'll be good.
That'll be great.
All right. And so did both of you obviously have the phone number and everything from Lisa. And I'd like to thank you again, Lisa, for coming on and doing this and, in the middle of dinner, so on and so forth.
No problem.
We appreciate it a lot. I'll probably send you guys an email because I know that we're probably going to want to do, I don't know if you're doing anything in person yet, but I'm hoping that maybe we could do maybe an in-person where we can kind of put these together, maybe B Medicare, B enrollment, open them, just give people
Sure,
some
right.
more
Okay,
and have people
probably.
come and then we can do a PowerPoint or whatever, but I'll keep you posted on that.
Okay, that sounds great.
All right. All right. Well, if there's no more questions, Dawn and Aida, thank you so much for coming. We really appreciate it. I hope this information has been helpful. And I guess we will see you all later.
All right, thank you.
All right.
Thanks,
Thank you very much, both of you. Take good care.
Take care.
Thank you both. The deck from Plan B was very helpful, and this was very informative. You're very welcome,
Thank
Dawn.
you.
Thank you very much.
Have a good night.
All right. Good night, everyone.
Bye-bye.
Thank
Good night,
you.
everyone. Good night.
Bye.
Bye-bye.